Today is part one of what health insurance is best for my child. We're going to talk about the HMO today, or the Health Maintenance Organization. I went to Humana.com's website and I think they have a really great definition, so I'm going to read it to you. The HMOs have their own network of doctors, hospitals, and other healthcare providers who have agreed to accept payment at a certain level for any services they provide. So basically, it's a bunch of healthcare providers that got together and they decided we're going to form this network and we're going to provide services for our members at a reduced cost. All of the services in an HMO are pretty much coordinated by the primary care physician, or the PCP. So in order to see a specialist, receive equipment, you will have to go through your primary care physician, and they're the ones who will refer you out to the specialist or to the doctor, or for the x-ray, or for the additional testing that your child may need. Some people love this because it's just a group of healthcare providers and they all communicate with one another about your child's services. Some people don't like HMOs because it's really expensive sometimes to go outside of the network. Your health insurance or the HMO will pay for you to stay within the network, but when you want to go outside of the network, you may end up paying a large portion of the costs or all of the costs. This may also be problematic also if you don't like your primary care physician, if you don't like your child's doctor. You may not agree with their assessment and you may find yourself pushing to get that referral. And you can't go to any place else unless you pay for it out of pocket. But HMOs can also be very good. If you don't need a lot of healthcare services, if your child is pretty much on the up and up and you actually trust your PCP, then it can be a wonderful experience. In terms of therapy, we find that HMOs are the gatekeepers to equipment and to additional services. So let's just say that you were referred for 12 visits to see the therapist, but you need more visits, you need to be approved for more visits. Well, your provider would be the one to approve that. We just couldn't approve that on our own. Continue following me in this series because I'm going to be talking to you about the PPO next. I want your child to be their best ever. So I will see you next time.